Introduction and the significance of our program. Historically, men are viewed as some combination of strong, impenetrable, and/or independent, unlike females who are expected to be emotionally dependent and able to express themselves more freely and be accepted by society. Typically, sexual assault as a topic of discussion holds a gender bias of being predominantly a female issue. However, this fact is very incorrect. A trend often seen with pre-existing sexual assault programs is that they are either too large in setting that it begins to feel impersonal, and also that they are usually geared at helping female survivors only or primarily, meaning that they accept males, but this is not their main area of focus. Victims of traumatic experiences such as sex crimes will almost certainly retain residual effects. These will usually manifest in the form of post-traumatic stress syndrome, or PTSD, negative self-image, and problems with feelings of depression and anxiety. They usually also have anger management issues. Since men are taught by societal norms to not express certain emotions, they become the most susceptible to carrying this trauma into adulthood. Statistically, according to a study done by the CDC, 16% of males will typically experience sexual assault by the time they reach age 18. This is a stark contrast from women because the same 16% of men who have a documented history of sexual abuse are only documented because it was so severe that a social service agency had to step in, compared to 64% of women who either self-reported their abuse or also had some type of agency step in. Our program, Stand Together Among Men, is a 3-session treatment group that spans over a 6-week period of time. Sessions will be held once every 2 weeks in 2-hour increments, and sessions will include activities and discussions that aim toward empowering men, education surrounding myths and negative stigma about sexual assault, and also improving mental health, such as low self-esteem and depression. We will also be introducing healthy coping strategies to reduce trauma and regulate anger. Stand Together Among Men will center around interactive activities instead of the usual technique of a round-robin support group method.
Target group. The inclusion criteria for our program, Stand Together Among Men, includes any men who is over the age of 15, who are also male survivors of sex crimes, and include any race and sexual orientation. Our inclusion criteria also includes men with disabilities. Additionally, we have also included men who are fully transitioned men. For the exclusion criteria, we have, of course, would include anyone under the age of 15, women, deaf men without hearing aids, and anyone with a sexual offense on their record. We have also decided that our program would be a closed group with a maximum number of 12 members. We believe that group cohesion is very important for our program, especially when dealing with such a sensitive subject such as male survivors of sex crimes. So we are aiming and hoping that our group develops bonds and trust where they feel they can speak freely among each other. A referral from a medical professional is required upon entry. They should have one or more characteristics such as PTSD, depression, or signs of violent tendencies. Additionally, to recruit, we will distribute flyers, brochures in places operated by medical professionals and law offices. We are aiming to reach men of all backgrounds and would advertise in libraries, health departments, and even counseling centers. So all men are encouraged to join. We also encourage men who speak Spanish, and we would have a translator on site during meetings.
Session curriculum. Okay. There will be several main components in our session curriculum. We will be previewing material being covered. We will review what has been covered after each session. There will also be the distribution of measurement tools, and we will also have a Q&A session. In session 1, the task group will introduce themselves in the program. They will preview the goals and objectives of the program and will also preview what will happen during this session. The task group will then go over the confidentiality statement as well as the non-disclosure agreement. The measurement tools for the program will also then be introduced, and the task group will explain what each one is for. The scales, along with the education assessment, will be distributed to the group. Next, the task group will distribute composition notebooks to each group member, and they will explain the importance of journaling their thoughts, feelings, and experiences. Once that is completed, the group members will be able to introduce themselves through an icebreaker. This icebreaker will be a musical chairs introduction, where the person who does not find their seat in time will draw a question from the hat and answer it. After this activity, 2 subgroups will be formed based on age. These subgroups will allow for the members to get a chance to talk and get to know each other better. The next activity will then be a trust exercise called Wheel in the Wind, where the group will surround one member and gently guide them around the group and keep them from falling. Once everyone has a turn being the willow, the task group will give the group a homework assignment to complete. It will be a timeline exchange. The task group will then review everything that has happened during this particular session and will answer any questions if needed. Soon after that, everyone will be dismissed. In session 2, the group will be reminded of the goals and objectives, and the task group will preview what will happen in this session. Afterwards, the task group will answer any questions if needed. Then the measurement scales will be distributed, except for the education assessment. The group will then give the task group their previous session homework, which will be the timelines, and the task group will distribute them anonymously, and the group will discuss how they feel about the exchange. Afterwards, the task group will bring in previous male sexual assault survivors who will act as mentors. The mentors will introduce themselves and tell their personal story. Once the introductions are completed, the group will be separated into 2 groups and paired with mentors to discuss coping skills. These coping skills will include the 4-7-8 breathing method, where you breathe in for 4 seconds, hold for 7 seconds, and breathe out for 8 seconds. Then you have the progressive muscle relaxation, which is where you tense every individual muscle and then you slowly relax them while breathing out. You have anchoring phrases, where you have a prepared statement that features maybe personal information that can be repeated. You have math and numbers, where you can do math problems or count down from 100 or count up to 100. And you have reciting, where you can choose a favorite quote, song, or anything personal to repeat. This activity will be monitored by the task group, and they will also encourage discussion among the members. Once this activity ends, the task group will introduce the concept of vision boards to the group, and the group will begin creating one. Since the vision boards won't be finished in the session, the boards will become the group's homework assignment. The task group will review everything that happened during this session and will answer any questions if needed. Everyone will soon then be dismissed. In session 3, the group will be reminded of the goals and objectives, and the task group will preview what will happen in this session. Afterwards, the task group will answer any questions if needed. The measurement scales will be then distributed, except for the post-education assessment, which will be taken later. The task group will encourage the group members to present the boards, and a discussion will take place after everyone has presented. After the presentations and discussion, the task group will introduce the 3 self-esteem activities for the group. There will be the negative mirror, where the group will be given a permanent marker in a mirror and write every negative thought they have about themselves, and then they will be asked to throw it away. They will then do a brainstorming activity where the group will then be asked what they can do to improve their self-esteem, and they will discuss each suggestion. Then you have the compliment fan, which will take place after the brainstorming activity. Each group member will be given a folded fan, and they will pass it around writing a compliment about their neighbor until it reaches the original owner. The group will take turns reading them out loud, discuss how they felt about the compliments. Afterwards, the task group will introduce the final measurement scale the group must take, and the group will be given the post-education assessment. The task group will review everything that has happened during the session and will answer any questions if needed. The task group will then pass out handouts and resources for the group members to continue their journey. They will arrange a date with the group members for individual termination plans. Then everyone will be dismissed.
Goals and objectives. Goals are to empower survivors by providing them with education, coping skills, and techniques that promote a healthy living. To educate, we want to reduce by teaching them methods on how to counteract them so that episodes will lessen at least to mild. We're going to reduce events, build trust between the men in the group, and learn how to trust each other and others. During session 1, we will start to educate the members. As we work on building trust among the members, we will start by having an icebreaker activity along with a building trust exercise called Willow in the Wind. Teach them skills that will help regulate emotions. We'll give them a journal for journaling that will help them express their emotions. Activities and interactions with fellow group members measured by observation with the observations assessment chart, standardized scales used to back up data for reducing trauma, regulating emotions, increasing knowledge, and boosting self-image. During session 2, we will continue with education. We will work on building trust and self-image. Have the members do a timeline exchange. Helps them realize they are not alone. This is important to survivors because they need to know others have been there. We'll introduce them to mentors that can help them better understand, do their vision board of what they want or what they want to do in the future. Give them skills to help manage anger and reduce trauma and regulate emotions, introducing them with coping strategies for anger. Also, will continue to help build self-esteem and self-image. In session 3, we're going to continue and finish with the education. Continue working on boosting self-image. We're going to do some skills or activities like teaching them mirroring and compliment fan. Interactive brainstorming activity to where we can brainstorm on things that we could increase our self-image and self-esteem and our trust between our peers and outside of the group.
Next, we have measurement tools. For this program, we've chosen to go with about 4 different standardized scales. First, we have the Rosenberg. The Rosenberg, we want to start where the clients are. So for the Rosenberg, it is a 10-question questionnaire which measures feelings towards self. Then we have a PTSD checklist, which is a 17-question questionnaire which measures stress, avoidance, loss of interest. Then we have the K10 scale, which is 10 questions that measure symptoms of anxiety and depression with a 1 to 5 rating. And last, there is the clinical anger scale, which is a 21-question multiple choice questionnaire, which measures anger and ability to regulate frustration. And all of these tests will be used in all 3 sessions. Lastly, there will be a pre-test and post-test, which will help us know whether our program was effective. And it is a 5-question true or false assessment to measure effectiveness of education. Then there's evaluation. As we stated in the measurements, we collected information that relates to depression, trauma, self-esteem, and anger. The distribution of duties will be up to the team leaders. This will vary upon group size and activities.